Today, we're talking about a wound that wouldn't heal no matter what we tried. Dressings, antibiotics, clean technique, nothing worked. But one small change made the difference. By the end of this video, you'll know what that change was, how to spot this problem in your own patients, and what to do about it. We all know the frustration. The wound looks clean, the treatment plan makes sense, but the healing doesn't happen. And we start asking, is it infection, poor nutrition, or something else? But sometimes it's something we don't expect, something so basic we overlook it. This story is about that moment, the one thing everyone missed until it was almost too late. For those who don't know me, my name is Dr. Voltaire. I'm a wound care physician. I've treated hundreds of wounds, and some of the most powerful lessons I've learned came from the wounds that didn't heal at first. This one changed the way I practice, and today I'm sharing it with you. Whether you're new to wound care, in training, or already seeing patients, this video will give you something to take back to your next shift. You don't need to be a specialist. You just need to understand how to look a little deeper and ask the right question. Here's what we'll cover: the full story of this hard-to-heal wound, the usual steps we took and why they didn't work, the small critical factor we overlooked, and how that one insight can help you turn around stall wounds. Stick around because at the end, I'll share a quick checklist of questions to ask when healing isn't happening. Let me take you back. A middle-aged man with diabetes came in with a wound on the ball of his foot. It wasn't new. It had been there for weeks. The skin was open, red around the edges. With some sloth, we cleaned it, dressed it, gave him a walking boot, and he came back in 10 days. No change. We reviewed the basics. Was his blood sugar controlled? Yes. Was there infection? Nope. Cultures were negative. Was the dressing appropriate? Absolutely. Was he offloading? He said yes, and still nothing. We did everything by the book: weekly debridement, moisture balanced dressings, patient education, and referral to endocrinology. We even double checked his labs. Everything pointed to this wound should be healing, but it wasn't. And with each week, it grew deeper, not wider, just deeper. That's when I knew something wasn't adding up. Then one day during a routine dressing change, a nurse asked, "Have we checked the inside of his boot lately?" I hadn't. We looked, and inside the offloading boot was a folded sock liner that had bunched up under the exact spot of the ulcer. Every time he walked, even though the boot was protective, pressure was being driven straight into the wound. The boot was helping, but only partially. We fixed it, we removed the liner, reassessed the boot fit, added a custom foam insert with a cavity right under the wound site, and the pressure was off. 10 days later, granulation. 3 weeks later, epithelialization. 6 weeks, closed. And here's the thing: nothing else changed. Not the dressing, not the diet, not the labs, just the mechanical load. It was a perfect lesson in how a small physical factor, something tactile, not clinical, can stall healing for weeks, and how one change can turn the whole case around. If you're caring for wounds that aren't healing, ask these questions. Is the pressure being relieved at the wound site and not just generally? Have you checked inside boots, shoes, socks, braces? Are patients using their equipment properly? Are there signs of shear or friction they might not notice? Sometimes the problem is an infection or poor compliance. Sometimes it's a folded sock under a boot, or a chair that tips the pelvis just enough to push on a sacral wound, or a splint that compresses a bony spot overnight. These tiny things have real consequences. Before you change the dressing or order another culture, ask, what's touching the wound for most of the day? How often is the pressure relieved? Is the patient using offloading gear consistently? Has anyone checked the inside of their shoes, cushions, or bed surface? If you find the answer to even one of these questions, you might find your breakthrough. This case reminded me that sometimes the most advanced wound care tool is just curiosity. Healing isn't just about what we apply, it's about what we remove, especially pressure. Thanks for watching. If you like this video, check out the next one where I break down how to use another wound care tool with the right wound. Stay informed and heal well.